Great. All right. So as you can see, I'm also a certified veterinary acupuncturist, studied Chinese medicine at Qi Institute, and also a fellow of the American Academy of Ozone Therapy. So I've been doing this ozonated glycerin since 2018 when I learned about it from the Japanese. And I've been treating a lot of cancer patients, and now I treat everything with it because, as you'll find out in a minute, it cures just about everything without any side effects. So, all right. So Japanese researchers have been doing it since 2001. They're trying to find something like ozonated water, but it last a whole lot longer. So by bubbling ozone gas through the glycerin, chemical reaction takes place. It takes a long time. And eventually becomes, you can see it gains 10,000 parts per million or 10 milligrams of weight from the OG. And the Japanese found that the half-life at room temperature is about 90 days. That's a lot better than ozonated water at 20 minutes. And if you throw it in the fridge, it's got a half-life of 16 to 18 months. And if you can freeze it, it's good forever. So it has antiviral, pretty much it kills all viruses, kills most bacteria, but not probiotics for some reason. It's super good on antifungal, antiprotozoal, anti-inflammatory, aids tissue repair and regeneration, and it's anti-neoplastic. Oh, and it also gets biofilm. So, and the most important thing it does is it kills pain. Okay, I learned about this from when I was at AAOT 7 years ago, and a professor from the Japanese vet school was talking about it, and he was mostly talking about ozonated water, how safe it is, how it kills cancer, does all this great stuff. But at the very end, he had like 2 slides about this ozonated gel he had that had a 90-day half-life. So I was pretty excited about that. And Dr. Schallenberger, who's head of the AAOT, and I talked to him, and he finally told us that we had to kind of work him over a bit, but we finally told us it was glycerin. So I've been using it ever since, and mostly the first 6 years on cancer. So I've given informed consent for experimental use, and I've given over 650 injections of OG to dogs and cats. Ozonated glycerin is very acidic and hypertonic, so you have to dilute it. So Italians also found it's anti-biofilm. It also has regenerative properties. So they confirmed the Japanese reports. So then we found that this book came out in 1885. They were using ozonated glycerin in New York City over 130 years ago. And it was as effective as hydrogen peroxide, but gentler and safer. And all the observations in this book, which is available on Amazon, correspond to what my observations are. And this was long before antibiotics, and it was curing all kinds of horrible things. So here's glycerin. It's half of a sugar molecule. You can see it's got 3 alcohols on it, so we call it a sugar alcohol. Ozonated glycerin has a peroxide, excuse me. And here's one glycerin. Here's the second glycerin, and then you got this peroxide, and this one's a high energy oxygen also. And here's glucose. So you see you have 1 methyl group. This has 2 methyl groups. So almost identical, but when the cells take this in, it releases the peroxide inside the mitochondria, and that does a number on cancer or microorganisms. And it slowly releases the oxygen into the body over 2 to 4 weeks in dogs and cats. So I stole this slide from the Japanese. So it's antibacterial, antiviral, heals wounds, stops bleeding, anti-inflammatory, antioxidant, prevents glycation, anti-neoplastic, pain reliever. That's the most important thing it does. Activates the immune system, gets rid of bad smells. And the only thing that's not on there is antiprotozoal. We'll go over that in a minute, but there's we've treated 60 horses with brain infection with a protozoan called EPM, and they're all doing great, unlike Western medicine. So here's the half-life thing. So if you freeze it, the half-life is indefinite. In the refrigerator, after a year, it was only at 70%, so that works out to about 16 to 18 months in the refrigerator. This is half-life. Now, the room temperature half-life was about 90 days. But when you see in a minute how strong this stuff is, it takes several half-lives and it's still quite effective. So safety, it's very hypertonic, so you have to dilute it. It's got a low pH, which doesn't feel great when you inject it. So to get rid of these side effects, we usually buffer it with sodium bicarb to bring the pH close to neutral. There's been some minor side effects in humans at 5% ozonated glycerin intravenously in humans. So similar to 10-pass or some of the other high energy ozone therapies. Occasionally you'll see a transient pink urine for a few hours and then it goes away. So it doesn't really do much, but people that do 10-pass or EBU, which is where they take blood out of one arm through a dialysis machine and add ozone to it and then put it in the other arm, they can see this hematuria. And we also noticed that occasionally you get some GI cramping and an osmotic laxative effect if too high a dose, whether you take it orally or IV. So we reduced the dose in humans to 1 ml of ozonated glycerin per 6 pounds of body weight, and we haven't seen any more side effects at that lower dose. I also recommend that you start with a quarter of the calculated dose, the first injection, then a half dose, then 3/4, and then you can use the full dose. That, if they're really sick patients, it keeps them from having any side effects. And when dealing with super compromised cancer patients, it's critical to start with a low dose and then work it up as they get stronger. If you kill the cancer too quick, you know what can happen. So go slowly. Here's another slide from the Japanese. So this is at 100 parts per million. My OG is at 10,000 parts per million, so you can see it can dilute it way down and it still works. So this purple one's Candida, kills it. This green one is a probiotic. It's called Bacillus subtilis. It's one of the few probiotics that can survive stomach acid. So it slowed it down, but you can see it didn't do much to it. And then all the bad stuff, we got Pasteurella, Staph, MRSA. There's another slide that has Legionella and several other nasty pathogens. So less than a minute, everything kills everything bad, doesn't kill the good stuff.
And right. Am I correct in saying that's probably an in vitro there, time-wise?
That one, yeah, that was in vitro, yeah.
Okay, great, thanks.
But we've seen it in animals too, that it kills the infection really fast. Okay, I've done a lot of cancer research. So intra-peritoneal for hemangiosarcomas, liver tumors, pancreatic cancer. If you have a local tumor, you can inject locally. So for that, we're doing 5% OG and normal saline. And that's kind of hypertonic. So 5% OG and saline is about 997 milliosmoles. So about 3 times normal body fluid. So it stays where you put it. It draws water towards it like other sugars. So for a 250 bag, I put in 12.5 mLs of OG, 3 mLs of bicarb to bring the pH up so it doesn't sting, and then put some lidocaine or procaine if you can get it. And then I'll show you an example of a dog that had a hemangiosarcoma that was 40 by 50 centimeters. And we put this much in the abdomen, and the tumor regressed over a month. So after it's in remission, you probably want to keep doing it monthly. So whether it's a local injection or intraperitoneal, that works really good. So here's how to calculate it. Human doctors can't think too well, so I have to make it excruciatingly simple for them. So we don't see too many 120-pound patients, but you'd give 20 mLs of OG in 400 mLs of ozonated glycerin and saline. So that's the math for human doctors. Local injections.
I know I'm going to get the question, can we dilute it in LRS? So what's your thoughts?
Yes.
Okay.
I've done it plenty of times, and the buffering system in there helps, actually. You don't probably need as much bicarb to bring the pH up to around 6.
Great.
So I've used it. It's no problem. Okay, local injections, you go circle the dragon. So you go round and under, above if you can. But you're trying to make an area of ozone around the tumor. And that kills the cancer cells. And for some reason, ozonated glycerin makes this stuff go back to its normal tissue. It's kind of blew my mind when I saw that the first time, but it's happened over and over again. So try not to inject into the mass. It's rarely effective and it's very painful. So as the mass gets smaller, you can get closer and closer to it. So here's the hypertonicity. And repeat every 14 days until it's in remission. Now for IV, we found that you want to use sterile water, and 2.5% is isotonic. So I'd use the same dosing schedule to cut it in half for a 60-pound dog. And, this is like D5W, it's 2.5 OG and W. So like I said, I have to calculate this out for people that can't think for themselves. Prolozone. I do lots of Prolozone injections. It's where you inject ozone, an irritant, usually 50% dextrose, but I just replaced that with the ozonated glycerin. It works even better. So one shot lasts up to a month. It's a lot less painful. And 1 ml of the Prolozone injection has 3,000 micrograms of oxygen versus a Prolozone where we put the irritant plus usually some B12 and some local anesthetic, and then add some ozone gas, and it works good, but you're only giving 400 micrograms of ozone gas versus 3,000. And this lasts for up to a month. This lasts about a week. So here's the formula to make your 10 mLs of stock solution. If you can get Procan, great. I can't, so I use lidocaine. You can also nebulize it, nasal spray. If you're going to use a nebulizer, I like the air compressor style ones, little handheld, cheap ones from China, and they tend to be very temperamental and stop working at the worst possible time. So I just make up a stock solution of 5 or 10% OG in water, fill the nebulizer cup up, and breathe it in. And you can repeat this twice daily. If you need the sinuses, use a mask. If you want to use the mouthpiece, you can get deeper into the lungs. Depends on what you're trying to fix. Nasal spray, I use 10% in water. And you can use it topical. Japanese like lower doses. I'm American, so I like high doses. 100% is good on the skin. If you have sensitive skin or on your face, you might not want to go full strength. You might want to dilute it. But rashes go away instantly. Insect bites, wounds, kills the infection and speeds up the wound healing. Atopy, it's interesting. It gets rid of that. Sunburn, age spots, poison oak. If you want to go deeper into the skin, you can add some DMSO. So I use 1 part DMSO to 4 parts OG. And you can put it right over a joint and the joint pain goes away. Herpes flare-ups, dog and cat bites. I'll show you a picture of me in a minute. Okay, this was a month ago. Had my assistant sew me up. A week later, I'm just putting DMSO and OG on it. 3 weeks, and this was 2 weeks ago. So looks pretty good. Oops. Okay. Ozonated glycerin has 10 milligrams per ml of ozone. Technically, it's singlet oxygen. So I get semantics from some of the other ozone doctors. So 10,000 micrograms or 10,000 parts per million. The Japanese like parts per million, so switching over to that. So in the last 3 years since I've had electronic records, I've given over 300 injections locally or intra-peritoneal on 50 different patients. So pancreatitis, systemic valley fever, if you live in the Southwest, you know what that is. It's a fungus that's in the soil, and in dust storms, you breathe it into your lungs. And if your immune system sucks, it takes over your body and kills you. 20 splenic and liver masses, mostly hemangiosarcomas, local masses, and chronic prostatitis. So number one, pain control. Second, for these really sick cancer patients, increases appetite and weight gain. So we get improved quality of life, increased energy. Most, but not all tumors just decreased in size. Most of the spleens that were bleeding returned to normal in shape per ultrasound. Some of these, after we got them back to normal, we used surgery and took the spleens out. Then we didn't have to keep treating them. Periodontal disease with sinus involvement filled up the extraction sites and flushed the sinuses with OG and healed much faster than normal. So that's basal. You can see that's going up into this sinus, but also went up into this sinus. So if you look closely, that's a root tip pick, and the tip of it is just under the skin right there. So he had a lot of teeth removed. So this is after a week. Look at that, head's back to normal. Got a little bit of puffiness there, pretty much all gone in 2 weeks. So I've injected over 300 joints with Prolozone the same time period. And you can see I usually put 1 ml into a stifle joint or on either side of the spine weekly for 8 weeks. Don't usually use ozone gas anymore. This is way simpler. It's ozone in a bottle. So we just give an injection. Luxating patellas, 90% improvement. I had one dog with an anatomical problem, and I couldn't fix that. But all the ones that have normal anatomy, I can fix. Luxating patellas. Torn cruciates, 95% improvement without surgery. And they don't get arthritis later. It protects the cartilage and regrows the tendons and ligaments. And it's not scar tissue, it's real cartilage and ligaments, according to all the research. Torn meniscus, 90% of those improve in 8 weeks. But I find that, at least in the dog, most stifle injuries are secondary to sciatica. So I think they lose feeling in their foot, and that's why they put it down wrong and tear the knee ligament. So now I treat it. Yeah, go ahead. Oh, L4-5 is where the sciatic nerve comes out, and that controls the back legs.
So most of the time when I see somebody of veterinarian or actually on the human side, them doing Prolozone injections, it's maybe 2 to 4 injections it's fairly common to do. You're doing 8 here. What would you say regarding that the quantity? What have you seen at lower, less frequent or less consistent?
Well, a lot of the human guys say up to 10, until the job's done. But in my experience, it takes about 2 months for them to heal. And I like seeing them once a week. And the owners see noticeable improvement. They start putting the foot down. First they're toe tapping, and then they're putting a little more weight on it. And as they're starting to get more confidence in the leg, they were putting more and more weight on it. At the same time, the drawer sign, where the two bones slide apart when you put tension on them, all that decreases over time too. And most of the time, I think it takes 8 weeks.
Okay.
So you can spread it out. It still takes about 8 weeks for that.
I think he's got some help there.
Yeah, let me see. There
Add
we
to your lecture.
Yeah. So
Um,
sorry about the interruption.
so that's good. What about doing injections for just a geriatric animal that's arthritic? Is that going to be helpful at all or not?
If it's their entire body, I like the therapy laser for that
Yeah.
because I use different modalities for different things. But if you're going to do the entire spine, it's way easier to use a therapy laser, a pretty good one like a companion or a K laser. I like the K laser, but
Mm.
high dose, and giving them like 3,000 or 4,000 joules and do their whole spine and hips.
Okay. Thanks.
Okay, horses. Japanese had they have a YouTube video actually. If you go to their site, it's pretty cool. Except it's in Japanese. But this horse fluffed off his foot and grew back, and he was able to work again in 9 months. And if you've ever seen horses with laminitis, they usually have to be put down if they're that bad. And one of my human doctors contacted me and his vet about his horse that had equine protozoal myelitis or myeloencephalitis. To CNS infection by a protozoal parasite from horses eating opossum poop. Who would have thought? Whatever. Anyway, think of it as malaria inside the brain. So these horses can't walk. They're either spastic or they fall over or they're not fun to be around. And they're super painful. And so they did 3 IV injections, and it's only 35 mLs. And you're talking 1,000 pounds. So it's a very small dose. And now the horses are completely back to normal. So at the AAOT last week, they told me they'd done 60 horses so far, 100% success rate. And if you ever treated one of these guys with Marquis, which is a anti-protozoal pharmaceutical, it's going to cost you about $5,000, and only 1 in 8 is writable after the treatment. So 100% versus 12%, I like it a lot better. And no side effects. So I had chronic sinusitis as a kid, and I lost my sense of smell before I went to vet school. So I've been using it as a nasal spray and got my sense of smell back. Had asthma as a kid, and using the nebulizer, it's magical. Really helps. I use water in the nasal spray or in the nebulizer. You can use it topically. Japanese have proved that it gets rid of age spots. It's a moisturizer. The glycerin softens your skin up. Gets rid of toenail fungus really nicely. I had some skin cancer on my ear that disappeared by using the topical OG after several weeks. Rashes. Dentists like it for periodontal disease. Gets rid of, well, back in the 1900, they found that it got rid of ulcers real easy. They didn't know we didn't know what ulcers were caused by until recently. So it gets rid of the H. pylori, and then it goes into the liver, cleans the liver out through the portal system. And to the body, it looks just like glucose with the peroxide inside as a Trojan horse. So it gives you extra oxygen, which is good for normal cells, not so good for cancer cells. And if you go to Dr. Rowan's YouTube channel, it's Robert Rowan, MD. And he has a lot of interviews with people that they're like 2 or 3 minutes long. He has them, most of them can't walk, so he shows them try to get to the door, sit down, and gives them a treatment and comes back and sees what happens afterwards. But we treated this lady. I had just given him a bag of Ozonated Glycerin and saline at a convention last November. And this woman walks into his clinic the next day, and she's had drug-resistant mycobacterium in her lungs for 4 years. And pretty much the human doctor said, "You're all going to die." She started taking that, and you can watch her. The video is great. She tells you how she felt fantastic after the first dose. and she's been getting stronger and stronger, and she's not coughing up blood anymore and not so much green goo anymore. So she's getting stronger and stronger. And it's amazing. There's another video on a patient that had regular Prolozone, and then she had the OG Prolozone, and she thought it worked a lot better. And then a rheumatoid arthritis patient that's had every kind of ozone possible. She's had, I think she probably had direct IV, joint injections, 10 pass, EBU. And she said that she likes the OG intravenously much better than all the other ones. And it's a lot cheaper. So nebulizing nasal spray, 10% water, once or twice a day. Orally, I like it. It tastes like sugar. So you can put it in a drink. You can take it straight. If you put it on your tongue, you're going to start salivating. And so just swish it around, kill all the bugs in your mouth, and swallow it. It's good for your stomach. So how do you know how strong it is? So we can test it with these test strips that are actually for hydrogen peroxide. So you make a 10% solution of OG and water or saline, doesn't matter, it still works. You let it sit for 24 hours. The peroxide in the OG needs to interact with the water for a while before the test strips will read. So you put the test strip in the 10% solution, let it sit for 5 minutes, take it out, wait 10 more minutes to read it, and then, as you can see here, the 10% is 1,000 parts per million, so the full strength stuff's 10,000 parts per million. And then we just diluted it again just for fun, turned it 5%, it's 500 parts per million. So according to the Japanese, you only need 10 to 100 parts per million to fix everything. So we got plenty extra in there. So you need USP grade vegetable glycerin. You can get that on Amazon. I like the oil bubblers. I think the bigger bubble does a better job. And then if your machine can make 100 micrograms per ml or 100 gamma, bubble it. 200 mLs takes 3 to 4 days. So a 500 takes about 8 or 9 days with my setup. Yeah. So here's, you see the straw here? So this is normal glycerin. And then after you've bubbled it for a while, you see the 3 holes at the bottom? You see the straw disappear? So it changes the optical density of the fluid. That's about the only change you see. It's not like ozonated oils where they change color and consistency. So, yeah, if you're making this stuff and the oxygen stops, the glycerin will migrate back towards your machine. So either have your machine above it or put a big loop in it, which I'll show you the picture. This is at work. So I have a big loop here from the machine. I also have a syringe filler, but and then it's going through the bubbler here, and then it's going into a destruct. You can see it sitting right there. Okay. So if you're using an oxygen concentrator, you need a pediatric flow meter because you have to slow it way down. And the chemical reaction takes time and temperature. Oops. So here's the olive oil. So that's, you can see it's Costco's organic olive oil. This is what it looks like when you start. After a week, it's been bleached. And at 2 weeks, it turns into a solid. Okay, so here's this case I was telling you about. 40 by 50 centimeter splenic tumor. On ultrasound, it looks like a sponge. It has like no texture to it. And she's 9 years old. She's about 66 pounds. And we gave her just 10 mLs of glycerin and some warm saline. I like my patients, so I give them warm fluids. They like it a whole lot better. Give it intra-peritoneally. 2 weeks later, we ultrasounded her again. The mass had decreased by 75% and had a half a spleen with a cucumber on the end. After a second injection, saw her back, and now she has a normal looking spleen. architecture looks completely normal on ultrasound. It might be a little bigger than normal, but it still looked more like a spleen instead of a bag of blood. Um, for some reason, the client didn't keep coming back for their rechecks and let it go for a while. The tumor started growing. Then we started getting more on schedule. And she lived 2 more years. Eventually, they got her. But she got 2 years of good life. And this is after her treatment. She was kind of cachectic with a huge swollen belly when we took this picture. So 1 ml per 6 pounds of body weight diluted in saline or water.
So
make sure it's at body temperature.
real quick, I think you've told this story before. So to you, it's old news, but that's when you did that.
Mm-hmm.
Take us back for a quick second
Okay.
to that moment. I can imagine that wasn't exactly what you expected. Uh,
Yeah.
so
It blew my mind that it grew back. The whole spleen, there was no spleen when we started. It's just like a giant watermelon sponge. And it regenerated the organ. And I've seen that again and again with the liver and spleen and other things that, normally we think, oh, we kill the cancer, it dies off, and then you got, an abscess or whatever. And then it fills in with scar tissue. Well, no, this regrows the tissue, the original tissue. The data is still there in the DNA, and it grew back, but it grew back in a month. That's totally mind blowing.
yeah. So after that, did it really? Did you start really increasing your usage of ozonated glycerin? Did that really
Yeah,
kickstart your journey?
exactly. Yeah, I've done, these ever since then. We've been going crazy, and then with the infectious diseases, it's even better. So
Cool.
yeah, it's definitely for the last year. It's been let's try it on everything, and so far it works on everything.
Mm.
Okay, so this is how I do intra-peritoneal. So he's just standing, he's awake. So there's an IV bag with his calculated dose up here. I got a 16 gauge 1.5 inch needle in my hand. I'm just going into the midline, caudal to the umbilicus. This is Wally. He doesn't have a spleen, so I'm not too worried about poking him in his abdomen. He had his liver was completely destroyed by valley fever. So we'll go into his thing in a minute. So it takes about, once you get the needle in, which you just go very slowly as you put it through the midline. Once it's in the abdomen, just crank the fluids wide open. And with that amount of height on it, it's full, the abdomen's full in about 3 or 4 minutes. They just sit there. They don't move. Just amazing. So make up the same kind of solution that I use for intraperitoneal, and we just inject it around underneath, and we call it circle the dragon. So you just go around the tumor. In cats, you'll see a seroma form at the injection site. I'll go over that in a minute. Sugar draws water towards it, and since cats have such loose skin, it kind of sucks some water in under the skin. But it went away after a month, so it's no big deal. So repeat every 2 weeks until remission, then monthly. So you can give it IV, you can give it nebulizer, you can do nasal spray, you can do it topically, you can do it orally. Nebulizing is awesome. One of my clients just sent me a picture of her dog. She makes put it in a very kennel with a bag over it, and then just has the hose coming out of the nebulizer, and the dog's got his nose right up against it because he likes it. Can drink it. It's all good stuff. All right, spirit. I don't see too many vaccine-associated sarcomas anymore, but this one had it bad. I had treated it before and had got it into remission, but the owner got stressed out, the cat got stressed out. And anyway, the vaccine associated, I guess they call them injection site sarcomas now, but I like adding the vaccine part. So anyway, they're little hard tumors in the skin, and it like spreads over the cat really rapidly. So I put it underneath all these things and around them. And cat comes back in 2 weeks, and there's no tumors. I mean, they're gone, and has this fluid pocket under the skin. And 2 weeks after that, the fluid pocket was gone. So no cancer, little seroma. Most people are pretty happy with that. And this is Wally. He's got valley fever. So he came from Arizona. He had a positive titer, and actually came in because he was foreign body in his stomach because he was eating weird stuff. So in Chinese medicine, pica is because there's inflammation in the gut, and they're trying to find something to put the fire out. It's not a psychological condition like Western medicine says it is. So there's a reason why they're trying to eat weird stuff. So we took all that stuff out of his stomach, and his liver was this color, tan. It was lighter than that. It was definitely like this color. And I did a liver biopsy, and we took his spleen out because it looked bad too. So after we did the splenectomy, as soon as he was awake, I put that fluid into his belly, and he's been getting that monthly for the last 2 years, and he's doing fantastic. Started gaining weight, eating well. His liver started to come back, and his liver values came back to normal in a month, and his fungal titer went down. So I'm worried that it's going to come back just because it's everywhere. And usually once you have valley fever, you got it for life. Pretty much everybody in the Southwest, including me, has it. Okay, so this is a friend of mine, is an integrative oncologist. He calculated this stuff out for me. So 5% in saline is very hypertonic. Sterile water, so if we give it 2.5%, it's 3 something. This is for humans, and most of the reports I get from my CBCs are in the 310 to 330. You can't get IV bags with sterile water. All right. So how are we doing on time? Because that's the most important part. The rest of it's just how to make it.
We got about, let's see, about 6 or 7 minutes. So go ahead and go ahead and move through this because I think there's going to be a lot of interest in this area too.
Okay, very good. So I'm going to go through it fast then. All right, so how to make it. So here's what you need. You need oxygen, either tanks or a concentrator, but you need a special flow meter because we're down in like 1/16 of a liter. You know, ozone generator that can do 100 gamma, oil bubbler, and all the extra gizmos. Plastic bottles are okay. A lot of people do glass, but it doesn't have to be. If you make more than you need, just throw it in the fridge. It's good for 1.5 years. So this is what I got on Amazon. This was the first 5 years, quart. And then I've gone through 2 gallons of this in the last year. So we're using it a lot now. I'm cheap, so it cost me like $100 a week to fill these tanks up. So we bought one of these setups as oxygen concentrator, and then this puppy compresses it to 2,000 pounds. So I can refill my e-cylinders for about 25 cents instead of $100 every week. So you get it from the. I'll have the stuff on the next slide. Okay, so here's my generator. Got it wide open, set it to 1/16 of a liter. If you want to fill, I use glass syringes because I don't like how it eats rubber. This is what you need if you have an oxygen concentrator, which I recommend because it's just, you're going through tanks really fast making this stuff. So you can set it way down here like a 1/16. I got this one from PromoLife. Okay, so here's my setup. Here's a little cool thing. If you have these Yorker bottles, there's a little line right here that holds this red cap in place. Well, if you cut it just above that line, a Luer syringe fits right on top of it. This stuff is really, really thick. Then you need at least a 16 gauge needle to put it into a IV bag. So you can suck it up in the syringe easily, and then you can add it to your diluent. So, all right, we've gone through all these things. Eye drops, 1%. 5% is a little too irritating. I think it's probably because of pH and stuff. Nebulizer. So if you know about MAH, so if you take blood out, add ozone gas to it, rock it, put it back in the body, uh, a human with 200 mLs and 200 mLs of ozone is getting about 10 to 12 milligrams of ozone. Well, nebulizer, you're getting almost that much in no blood, no expendables, and you're using the lungs as your delivery system. You can also use a hard surface disinfectant. For the next pandemic, this is what I do. Like I've been traveling a lot lecturing, so if you use a mask, you know it's not working on viruses. So spray it with the 10% OG as a disinfectant. Then I use the nasal spray before the plane, after the plane, when I get to the hotel, and or if somebody coughs on you, just spray it up your nose a couple times. And if you want, you can nebulize too if you want to get deeper into your lungs. 8 weekly injections usually fixes an unstable joint. So 1 ml every 8 weeks, once a week for 8 weeks. It probably could do it every couple of weeks, but I like seeing them every week, and they're pretty happy with the results. So equipment, this is what you want to know. So I got this stuff from PromoLife. There's other manufacturers. Oil bubbler, and I got the pediatric flow meter for the oxygen concentrator from them. Oxygen concentrator store, you don't need the home fill unless you want to add it to your clinic. And this is the little adapter that allows you to use the CGA is the medical oxygen adapter. So you can use it on e-cylinders. Okay, here's sterile IV bags. And then kills COVID. And it actually worked better the more blood was in the area than you would expect. Ozone does the exact opposite. As soon as it's inactivated by the blood, it's gone. This worked better. So I thought that was cool. And there's a lot of stuff. This is all from PubMed. So increases bone production, gets rid of age spots, gets rid of inflammation from lipopolysaccharides. They use that as to induces inflammation and cell damage in research projects. And this is my favorite. BHT is a food preservative that's antiviral, but it also stops autoimmune hemolytic anemia. It's a membrane stabilizer, prevents radiation damage, gets rid of hangovers. And here's the dose. And that's it. Okay. Questions?
Awesome. Thank you for going through that so concisely. That's great. So I think I just came up with a couple questions as you were going through. What are your thoughts on this not really being a problem with probiotics, but being able to, eliminate some of those harmful pathogens?
Mm-hmm.
Any ideas on why that would be?
It's magical.
Yeah.
I don't know. Only God could have come up with something that kills all
Yeah.
pathogens but leaves the good stuff
Yeah.
alone. The only thing I haven't tested is whether it affects the nitrate producing bacteria on your tongue that produce nitric oxide. We haven't tested that, but I have some people working on that. We're actually starting a whole bunch of research projects right now. So
Okay, great. Well, we'll have to stay in touch then because I want to hear how things go. Maybe 6 months we can do some sort of webinar. And I know there's going to be people who are disappointed that you're not at the event, because they want to ask you questions. So maybe a little bit further down the road we can have a live event where you're able to answer some of those questions. But um, how do you determine whether you're going to inject this IP, topically, IV, how do you determine how to administer it?
Depends on the case.
Yeah.
So if it's an abdominal tumor, I like IP for that because it's going to basically bathing the tumor in a solution that's full of oxygen.
Hmm.
And if it's, I had a weird case the other day. It was viral pneumonia in a cat. So I just squirted some in the lactated ringers it was getting. And within a few hours, pneumonia is gone. So stuff like that happens all the time. There's no Western treatment for some things, or it's too toxic. And I'm getting awesome results. I'd say it's probably as non toxic as water. I mean, you can't die from water intoxication, but you have to really work at it. You really can't kill yourself with this stuff. Yeah, it doesn't feel good if you put it too concentrated or it's, pH is low, but you can adjust that.
So, do you approach it from various angles? Let's say you do have a tumor. Um, do you inject it around that tumor and also do, an IV treatment, or do you typically go with just one method?
I have this one case that they drive like 2 days to get to me, and it's got a adenocarcinoma of the anal gland that's like a sausage that's growing into the abdomen. So it's compressing the colon. And so he got all three. And so injected around it where I can see it at the back end, and I can feel it in the abdomen, and it keeps getting smaller. So I put some in the abdomen, and since I go so long, I mean, they come from Salt Lake City. I'm in Southern Oregon, so do the math. That's a long way to go. So we did IP and local injection on Thursday, and then Monday I gave them an IV, and then I went back to Salt Lake City, and now they're buying a place out in Oregon so they can stay out here so I can treat it.
Mm, wow.
So
Uh, so when you're doing these OG treatments, is there any other treatment that you don't do in conjunction with it? Um, People, or do you like to combine it with other treatments that you're doing in particular?
um, sometimes, like, there's some tumors that this doesn't get into, like lymphoma. I've had a real problem with, but
Mm.
I think adding DMSO to it uh, is going to get it into the lymphatics and get it in. A friend of mine's a doctor in Africa, and he's actually got a lymphoma patient that he's treating, and he says it's starting to work. So we'll see.
Hmm. Okay.
But the only thing I would caution is if you're using the therapy laser, do the laser first, then ozone, not the other way around, because you can accelerate the ozone. I'll give you an example. I was doing Prolozone on this knee, and it was getting better, but then using the therapy laser afterwards kind of activated all the ozone in the knee, and it got rid of all the scar tissue that was holding the knee together.
Oh, wow.
So now I do laser first, then ozone.
Okay.
I've made plenty of mistakes, and I learned all these things. So now I'm making the safety thing, so you don't go through what I did.
That's why we're talking to you. Um, yeah. Uh, so how long have you done ozone therapy for? Not ozonated glycerin, but ozone therapy.
So became a fellow of the Academy of Ozone Therapy in 2015.
Okay.
So 10 years.
So, and it's only been the last year or two that you've been doing ozonated glycerin, or
No, I've been doing it since
longer?
2018. So I've been doing
Oh,
it for 7 years. Just the last year doing all kinds of crazy stuff. The
okay.
first was mostly cancer, but now, especially after we found that book from 1900, they treated everything with it because they didn't have antibiotics, and it worked good.
Mm-hmm.
So,
So, all of the people here at this, well, many of the veterinarians obviously are doing ozone therapy, and they're using ozone gas, they're using ozonated saline, they're using ozonated oil. Um,
mhm.
and they use those for various things, you know, in similar ways to how you're using ozonated glycerin. Um, but what would you say you've, how would you encourage a veterinarian to use ozonated glycerin? Do you think it takes the place of all of those other forms so that you really don't use ozone gas or don't use ozonated saline or don't use ozonated oil? Um,
Well, it's okay. It's ozone in a bottle. So, yeah, you don't need saline because you can just inject it into it and it's going to last way longer. The problem with ozonated saline, it's only got a 20-minute half life. And it's only about 20 parts per million. It's hard to get it above that. Um, just one drop of this is going to have way more ozone in it. And it's stable, so you can put it in an IV bag and you don't have to worry about it all day.
mhm.
Um, um, oils have their places. You can inject this, you can't inject oils. So we're having pretty good success with SIBO, small intestinal bacterial
Mhm.
overgrowth with this. Um, the book from 1900 said they were fixed all upper GI problems with it back then, and you could do it rectally, do an enema. We've washed the bladder out with it. It's really good for drug-resistant bacterial infections,
Mhm.
things like that. So bladder cancers. A friend of mine's a human doctor. He's treated a whole bunch of them. He puts a catheter into the bladder and then injects the diluted OG in there and lets it sit for an hour or so and then drains it out.
Mhm.
And he's having good success.
So these other, you know, modes of applying ozone may have their place alongside of ozonated glycerin at times. Uh, but is there any one, let's say you could only use ozonated glycerin for one condition. Which one would you treat? What would you use it on?
It's good for everything. It's a
I know
panacea.
that's, I know that, but
So I started with cancer, and it works most of the time. It always makes them feel better. It gets rid of their pain. They eat, their quality of life goes up. Even if it just stops the cancer and they live with it for a couple more years. Most people are super happy with that. Now, infectious diseases like the horses with the EPM, it's fantastic. I mean, the horse doctors are going crazy with that right now. Also, laminitis, so where their hoof sloughs off or
Yep.
inflammation that causes severe pain. It's working on that. They're doing a I got a couple of people doing research projects on laminitis and EPM in horses, and fantastic results so far.
So it'd be hard to narrow it down
It pretty much you
to
can
one
treat
area.
anything with it, and it prevents antibiotic resistance. So you can use it A instead of antibiotics or B with antibiotics. The Cubans proved that um, if you mix ozone and antibiotics, it works better than, at least on drug resistant infections.
Hmm.
Um, it works better.
So it's more convenient. I hear that
Oh, yeah.
for
Yeah.
sure. Let me rephrase my question though. So if you had to use ozonated glycerin as opposed to being able to choose ozone gas or saline or oil, where would you say, this should probably replace one of those in your practice, or would you?
Um, it certainly can replace ozonated waters and saline.
Yeah. And to treat anything in specifically, like it does a better job treating this than you can with those other methods. Is there anything that would stick out as in your
Well, you can
mind or not?
inject it. You can inject it and have a long duration. So in people, since they can give us more feedback,
Hmm.
like the woman had rheumatoid arthritis. She said one IV got rid of all of her pain for over 3 weeks.
Mm.
One injection. Now we know that the other blood therapies don't last that long.
Mm.
And you're giving a lot of it. So this little 1 ounce bottle has 300,000 gamma in it.
Wow.
It's mind blowing. That's more than you get in Ebu or some of these other super, super expensive, and you don't need a $30,000 machine to give it.
Yeah.
You don't have to touch blood. You can just put in a butterfly and give them an IV injection.
And you would dilute that if you're doing IV then.
Oh, absolutely. Yeah.
Yeah.
2.5%.
But you're saying you could drink it
Oh, yeah. I do it all the time.
and you don't need to dilute it.
No. I wore a Freestyle Libre sensor, a cutaneous glucose sensor, and I tried chugging as much as I could, and it went from like 100 to 130 for like 2 hours, went back down. But then I have a normal blood glucose curve.
Now, this is probably something that animals would be much more likely to drink, right? Than
Oh yeah,
saline
I just pour it on my dog's
or
kibble,
water.
and they love it.
Yeah.
You can put it in the water if it's a good mouthwash and gets rid of the smell in their mouth.
Well, that's great. I mean, that's a because ozonated fluids, animals, most of them won't touch. Most of them won't drink that.
Yeah, this stuff tastes like sugar.
Yeah.
Great.